Good morning, ladies and gentlemen. On behalf of the entire team at Cancer Care Ontario and all of our partners, I'm very pleased to present the Ontario Cancer Plan. This plan provides a roadmap to continue our journey to create the best cancer system in the world in Ontario. Over the next 4 years, we will deepen our efforts to improve quality and innovate with clear accountability for performance. Our plan recognises the need to achieve the best value for our taxpayer dollars in the cancer system. And our plan puts patients, their families and the Ontario public firmly at its centre. Our approach to improvement builds on the successes of the first two Ontario cancer plans. But we also recognise that our collective challenge is increasing as the number of people who get cancer continues to rise, largely due to ageing and population growth. And we recognise the need to do more to meet the needs of patients and families as they undergo intensely personal journeys through diagnosis, treatment and follow-up care. We need to help Ontarians reduce their risk for getting cancer. And we need to ensure that they are screened for cancer appropriately so their cancers are caught as early as possible to improve the chances for a good outcome. This morning, I will tell you how we've built this plan together with partners to improve the cancer system. I will share our collective achievements through the first two cancer plans and outline the priorities for action to address the growing challenge over the next 4 years. How have we developed the plan and what do we need to put in place to ensure success? The plan has been built over the past year with strong input from patients, from regional cancer programs, our partners in local health integration networks and the Ministry of Health. We have sought input from the Canadian Cancer Society and other charitable cancer organisations, from cancer researchers and organisations including the Ontario Institute for Cancer Research. All of this input has shaped the Ontario Cancer Plan. We have found that success in improving the cancer system depends on several critical factors. And probably the most important of these factors is the engagement of healthcare providers, doctors, nurses and hospital leaders. They are central to developing the plans for quality improvement and in accepting accountability to implement these plans. We engage healthcare providers through a cycle of quality and performance improvement, collecting information and data on the system we have, identifying opportunities for improvement, developing and implementing standards and guidelines, and reporting our progress to ourselves and to the public. Using this improvement cycle with common standards and measures in communities and hospitals across Ontario creates clear accountability for action. We have anchored accountability locally by establishing regional cancer programs in every local health integration network. Each is led by a regional vice president, and they work with clinical and administrative leaders in their region to oversee regional planning, implementation and quality improvement based on the priorities of the Ontario Cancer Plan. We measure and report on progress against all the priorities. We rank each regional cancer program, and we work continuously with the regional vice presidents and clinical and hospital leaders to keep the pace of quality improvement rapid. And importantly, our progress is also monitored and reported publicly through the work of the Cancer Quality Council of Ontario. Implementing the plan depends on developing and collecting good system data. It relies on modern facilities where our healthcare providers can deliver safe, high-quality care. We depend on research and surveillance of cancer in our population and our ability to provide excellent economic analysis to ensure value for money. Using this approach, we have made significant and measurable progress in the last 6 years of the two previous Ontario cancer plans. We worked with the Ontario government to open 4 new cancer centres in Kitchener, Mississauga, Oshawa and Newmarket. 4 additional facilities are now under construction or being expanded in Barrie, Niagara, Kingston and Sault Ste. Marie. And we have expanded centres in London, Hamilton, Sudbury and in Ottawa. So that by 2013, over the last 8 years, major new facilities will be in place in 12 cities across Ontario. This is a significant achievement. Standards to ensure quality were established through our program in evidence-based care and then implemented across the cancer system. Wait times were significantly reduced for cancer services. Through Smoke-Free Ontario, we achieved stronger tobacco control, and Ontario was the first province in Canada to launch colon cancer screening program through Colon Cancer Check. And most recently, we have, in partnership with the Ontario Institute for Cancer Research, launched the Ontario Health Study. This study will follow thousands of Ontarians to provide the information we need to continue to reduce the burden of cancer in the future. These are significant accomplishments, but we have a growing challenge, and that is driven by simple demographics. Cancer is largely a disease of aging, and we have a growing population that is living longer. So we must go further and faster in our improvement efforts. The underlying risk for you or I to get cancer is relatively flat and is in fact reducing for some cancers, including lung cancer. But we will see the number of cancers rise in Ontario over the next 4 years and beyond, primarily because we have a growing population which is also aging. 45% of males and 40% of females can expect, at the current rates, to develop cancer within their lifetime. And because of the very good success in improving survival for almost all cancers, many more people are living with cancer. They need our support and care in order to continue to lead fulfilling and productive lives. Our plan to meet this challenge is ambitious, but it is practical and it is achievable. Our vision remains the same. Quite simply, we aspire to have the best cancer system in the world for Ontarians. And we will do this through continuing to drive quality, accountability, and innovation in all cancer-related services. The plan has 6 goals. Those are to help Ontarians lessen their risk of developing cancer, to reduce the impact of cancer through effective screening and early detection, to ensure timely access to accurate diagnosis and safe, high-quality care. We want to improve the patient experience along every step of the cancer journey, to continue to improve the performance of Ontario's cancer system, and strengthen Ontario's ability to improve cancer control through research. With the help of partners in the development of this plan, we have identified 6 strategic priorities for action that will enable us to achieve these goals. The first priority is to develop and implement a focused approach to cancer risk reduction, so that we can reduce the rates of cancer incidence in Ontario. By 2015, primary care providers will have the tools they need to work with their patients to reduce their risks for getting cancer. And every person in Ontario will be able to calculate their own cancer risk. Secondly, we will implement a single integrated cancer screening strategy so that our participation rates in cancer screening increase. So by 2015, we will have implemented one strategy for breast, cervical, and colorectal cancers, supported by a single information system. And support services will be in place to ensure individuals who do have an abnormal result receive the follow-up care they need in a timely way. We will continue to improve patient outcomes through accessible, safe, high-quality care. By 2015, we will make sure that evidence-based guidelines are more readily available for doctors and nurses at the point of care. 90% of chemotherapy treatments will be supported by computerized physician order entry. And specialized cancer nurses will be in place in cancer centers across the province. We will continue to assess and improve the experience of cancer patients in Ontario. By 2015, every cancer patient will have access to electronic tools and information to help them navigate through their cancer journey. They will be able to report their symptoms electronically so better care can be provided. And they will receive care in a timely way for both physical and emotional symptoms. We will develop and implement innovative models of care delivery that are better for patients and more cost-effective for the cancer care system. We will provide electronic tools for patients to allow them to participate more fully in their care. And the final priority is to expand our efforts in personalized medicine. By 2015, we will have a cancer system that is more responsive to emerging research. The evaluation and the introduction of new tests and treatments in Ontario will be strengthened and more responsive, and will provide patients and the healthcare providers with the information they need to choose the right tests and treatments for them. These are examples of the concrete commitments we are making in the Ontario Cancer Plan. The plan has been developed and will be implemented according to our guiding principles. The plan will be transparent to all. It will ensure equity so that all receive the high-quality care and support they need. What we do will be based on good evidence. We will continue to improve the performance of the system, and we will engage patients, the public, and healthcare providers throughout the implementation of this plan. And importantly, we will ensure excellent value for taxpayer dollars. Each of the strategic priorities is comprised of a set of specific and focused initiatives with a clear plan for implementation and measurement so that we can all be engaged in seeing the progress we are making. We have developed detailed business plans for these initiatives, and we understand that these will need to be assessed by the Government of Ontario against all of their priorities in this very challenging fiscal environment. But with everyone's support, we believe that the transformation we are witnessing in the cancer system in Ontario will continue apace. It will continue more broadly and deeply, and will provide real hope to cancer patients and the public that their needs are truly being met in a very cost-effective way. This is not just Cancer Care Ontario's plan, it is our plan, and this is our work together for the next 4 years. Thank you.